Welcome to the deep dive. We're doing things a little differently today. Focusing on you guys, the leaders at Maximus's CCO, and we're going to be talking all about what's new in the world of Medicare and the marketplace and, all the stuff that you guys are dealing with on a daily basis.
Right.
So consider this deep dive like your little cheat sheet for what's hot in healthcare policy.
Yeah.
We've got a whole stack of articles, reports, and even a podcast episode from Health Policy Insight all about Medicare and the marketplace.
A lot to keep up with.
It is.
For sure.
And one of the things that really struck me was all this news about marketplace enrollment numbers. Healthcare.gov is reporting 16.6 million qualified health plan selections through healthcare.gov,
Wow.
which is the highest ever for January 1st coverage.
That's impressive.
It is. I mean, it seems like the Affordable Care Act is, more popular than ever.
Well, the numbers look great on the surface, but there's a lot more to the story.
Right.
It's not quite as simple as it seems. Well, a lot of this increase is due to something called passive auto re-enrollment.
Oh, yeah.
Basically, it means folks are automatically re-enrolled in their existing plans.
Gotcha.
Which, isn't necessarily a bad thing in itself, but
Right.
it can lead to some surprises down the line.
Okay. Surprises like, what are we talking about? Like higher premiums.
Exactly. Higher premiums. People might not realize their plans have changed or that their rates have gone up, and they could be hit with sticker shock when those bills start rolling in.
Ouch.
Yeah. And to make matters even more interesting,
Okay.
the CBO, the Congressional Budget Office, is projecting that millions could lose coverage if the subsidies from the Inflation Reduction Act, those IRA subsidies,
Right.
if those aren't extended. So that could create a lot of confusion, a lot of frustration among consumers.
I bet.
And yeah, you can imagine the impact on the CCO.
Yeah, a lot more calls coming in for sure.
Oh, yeah, definitely.
So it sounds like you're saying that while these high enrollment numbers are, good news on the surface, we need to kind of be prepared for some potential fallout.
Exactly. We've got to be ready for the impact of passive re-enrollment, the potential for those subsidies to expire. And we really need to think about how all of this is going to affect consumers.
Right, and how we can best support them through all of this.
Absolutely. It's about anticipating their needs and being prepared to guide them through these complexities.
For sure. And speaking of complexities,
Yeah.
let's talk about the Moviet data breach.
Oh, yeah.
This wasn't just some abstract news story. This hit us directly.
It did. And the legal fallout from that breach, I mean, it's got huge implications for data security across the entire healthcare sector. I mean, what's really eye-opening is that a court actually clarified that the risk of future harm from a data breach,
Okay.
that's enough to establish legal standing.
So it's not even about actual misuse of the data.
Right.
It's just the potential for misuse.
Exactly. Just the potential is enough now. That's a big deal.
It is a big deal. I mean, that really raises the bar for data security practices everywhere.
It does.
It's not enough to just react to breaches anymore.
No.
We need to be proactive,
Absolutely.
identifying vulnerabilities, implementing those safeguards, before anything even happens.
You got it.
This makes me wonder, what does this mean for data security protocols at Maximus going forward?
Well, one thing's for sure, the legal landscape is changing.
Yeah.
The stakes are higher than ever, especially when you're dealing with sensitive personal information, health data. Organizations really need to be more vigilant than ever about protecting that data. That could mean strengthening existing security measures,
Right.
investing in new technologies, prioritizing employee training, you name it.
So this isn't just about IT anymore.
Right.
It's about creating a whole culture
Exactly.
of data security awareness across the entire organization.
It's a shared responsibility. Everyone's got a role to play.
Okay, let's switch gears a little bit here and talk about telehealth. I'm actually seeing some good news here. A recent funding bill extended those telehealth flexibilities.
Yes, that's a win.
It is. It's a win for expanding access to care.
Absolutely. But those extended flexibilities also bring some new challenges.
Like what?
Well, there's been a lot of discussion about using telehealth to prescribe weight loss drugs.
Oh, yeah, like Ozempic, Wegovy.
Exactly. And there are concerns about potential overprescribing, making sure it's used responsibly, particularly for folks with eating disorders.
I see your point. It's a powerful tool.
It is.
Telehealth can be. But we need to make sure it's used appropriately.
Absolutely. We need safeguards in place to prevent misuse
Right.
and to ensure patient safety.
Okay. Let's dive into Medicare now. It seems like there are some significant policy shifts on the horizon. maybe driven by the new administration.
Yeah, there's a lot going on.
There is.
One thing that's got everyone's attention is the Medicare Prescription Drug Inflation Rebate Program.
Oh, yeah. That one's starting to make some waves.
It is. It's showing some promise in terms of delivering cost savings for beneficiaries. But, it's also got potential implications for the pharmaceutical industry.
I bet they're not too thrilled about that.
Well, it's definitely putting some pressure on them.
Yeah.
The question is how they'll respond in the long run. Will they change their pricing strategies? Will they focus on developing drugs that aren't subject to those rebates?
So wait and see, I guess.
That is a wait-and-see game.
And then there's also that issue of Medicare Advantage disenrollment.
Right.
Data shows that folks with higher health needs,
Yeah.
they're disenrolling at a faster rate.
That's concerning.
It is. Makes you wonder if these plans are really equipped to handle those more complex medical cases.
Right. And if sicker beneficiaries are shifting back to traditional Medicare, that could mean increased costs for that program, potentially straining the whole system.
We need to figure out what's driving those disenrollments.
Absolutely.
And then find ways to improve care coordination and support for those folks with complex needs, no matter what plan they're on.
Agreed.
Okay, let's move on to something that's always top of mind during open enrollment season.
Oh, I know what's coming.
Scams and fraud.
It never ends.
It doesn't. We're seeing this huge surge in health coverage robocalls.
Oh, yeah.
And it's not just a U.S. thing either.
Oh, yeah, it's global.
It is. These scams are getting more sophisticated, mimicking legitimate calls from government agencies or insurers.
It's scary how convincing they can be.
It is. And it really highlights the need for, those robust call blocking technologies. And we've got to educate consumers
Yes.
to help them identify and avoid these scams.
Empower them to protect themselves.
Exactly. And then, of course, we've got the ongoing complexities around the DACA ruling,
Oh, yeah.
which has created such a confusing situation
For everyone.
for everyone, for DACA recipients and for those trying to help them enroll in coverage.
Right. You've got this court decision blocking DACA recipients from accessing those ACA subsidies, and then different states are interpreting it in different ways, implementing it differently.
It's a mess.
A real patchwork of eligibility.
It is.
Yeah.
And navigating that patchwork
Yeah.
can be so difficult for consumers and for the folks trying to help them.
Right.
Sounds like the CCO has got a big job ahead.
Oh, yeah.
Keeping up with all these changes
Mm-hmm.
and making sure their teams have the knowledge and resources to support those beneficiaries and consumers.
For sure. It's all about being adaptable, informed, and ready to navigate this constantly shifting landscape.
It's okay. We've covered a lot already.
Hmm.
And it feels like we're just getting started.
We've just scratched the surface.
We haven't even delved into those proposed CMS rules for 2026.
Oh, those are big.
They are. They could have a huge impact on how the CCO operates. So let's take a pause here, and then we'll come back and we'll dig into those CMS proposals and figure out how Maximus can really position itself for the changes ahead.
Sounds good. The CMS proposed rules we were talking about, they really are a game changer, especially for Medicare Advantage and Part D plans.
So what's got CMS's attention this time around? What are the big things they're focusing on?
Well, one major focus is cracking down on misleading marketing practices.
Okay.
They're proposed to broaden the definition of marketing to include pretty much any communication that could influence a beneficiary's plan choice.
Wow. So we're talking about everything.
Pretty much. TV ads, brochures, those events they hold at community centers, it's all under the microscope now.
That seems like a pretty big shift.
Yeah.
Why are they coming down so hard on marketing all of a sudden?
It all comes down to protecting beneficiaries. There have been a lot of complaints about misleading information, especially regarding supplemental benefits. Those extra perks, like dental or vision coverage, or those prepaid debit cards some plans offer.
Oh yeah, those cards. They seem to be everywhere these days.
Right. Well, CMS wants to make sure that all marketing materials give a clear and accurate picture of what a plan actually covers.
Makes sense.
No more confusing language. No more relying on those flashy extras that may not actually be that valuable.
So it's all about transparency.
Exactly.
Making sure beneficiaries have all the information they need to make informed decisions.
That's the goal. And speaking of transparency, another area where CMS is pushing for improvement is in provider directories,
Okay.
specifically for in-home service providers.
So if someone needs help with things like bathing or dressing at home,
Right.
you'll be able to easily see which providers are available through their plan.
That's the idea. It's about giving beneficiaries more control over their care and making sure those directories are accurate and up to date.
So we've got marketing crackdowns, provider directory improvements. What else is on CMS's agenda?
Mental health parity is a huge focus.
Okay.
They're actually proposing to require Medicare Advantage plans to align their cost sharing for behavioral health services with traditional Medicare.
Cost sharing meaning like copays and deductibles and things like that.
Exactly. By aligning cost sharing with traditional Medicare, the goal is to make mental health care more affordable and accessible.
So basically, they're trying to put mental health on par with physical health.
Precisely. It's a recognition that mental health is just as important as physical health and should be treated accordingly.
This all sounds like it's going to require some adjustments from Maximus, especially for the CCO team.
Oh, absolutely. These proposed rules could really change the way the CCO operates.
In what ways?
Well, with all this increased scrutiny on marketing materials and this new emphasis on transparency, it could have implications for agent training for call scripts, even for the types of questions beneficiaries are asking.
So it's not just about understanding the new rules. It's about anticipating how those rules are going to change the dynamics of the CCO's work.
You got it. It's about being proactive and preparing for those shifts. Maximus leadership will need to think strategically about how to best support their teams through all this.
So let's shift gears a bit and go back to that discussion about prescription drug costs. That's something that's on everyone's mind these days.
It really is. Drug costs are a huge concern, and we're seeing that play out in a few different ways. On the one hand, you've got the Medicare Prescription Drug Inflation Rebate Program, which is starting to have an impact on curbing price increases, at least for some medications.
But I'm guessing the pharmaceutical industry isn't exactly thrilled about these rebates.
Well, it's definitely putting some pressure on them. The big question is how they'll respond in the long term. Will they adjust their pricing strategies? Will they shift their focus to developing drugs that aren't subject to these rebates? It's a bit of a wait-and-see situation.
And then on top of that, you've got this issue of patent stacking.
Oh, yeah, that's a tricky one.
Which is basically this tactic some drug companies use to extend their monopolies and delay the entry of cheaper generics.
It's a complex legal strategy, but basically they're obtaining multiple patents on slight variations of a drug, which effectively blocks generic competition for years. And that keeps those prices high.
So instead of one patent for a drug, they might have several patents for different aspects of that drug,
Right.
like its formulation or method of delivery. It's like a patent fortress.
That's a good way to put it, and it's a practice that's been drawing a lot of attention from lawmakers. They're looking for ways to curb this practice and make those generics more available.
It sounds like there's a real push to lower drug costs, both through programs like the Medicare rebates and by tackling tactics like patent stacking.
Absolutely. Drug affordability is a major issue, and it's something that affects everyone, patients, policymakers, even those working at the CCO.
Great. Before we move on, I want to touch on one more thing. We talked earlier about those supplemental benefits offered by some Medicare Advantage plans. Are those benefits always as good as they sound?
That's a great question. It's really important for beneficiaries to carefully consider the value of those supplemental benefits.
Okay.
They can sound appealing, but they may not actually provide much real-world benefit. For example, a plan might offer a dental benefit, but it could have very limited coverage, leaving beneficiaries with high out-of-pocket costs.
So it's not just about having a benefit. It's about understanding the details of what that benefit actually covers.
Exactly. Beneficiaries really need to review those plan materials, and they need to ask questions to make sure they understand what they're getting.
All right. That was a lot of information about Medicare. Let's shift back to the marketplace now and talk about some of the challenges consumers are facing during open enrollment.
Yeah.
We mentioned those robocalls earlier, but there are other issues to be aware of as well, right?
Oh, for sure. One issue that's been particularly challenging, especially for those in states relying on healthcare.gov, is all the confusion surrounding the DACA ruling.
Oh, yeah, that's a tough one.
You've got this court decision blocking DACA recipients from accessing those ACA subsidies, and then you have different states interpreting and implementing it in different ways.
So no wonder consumers are confused.
It's a real patchwork of eligibility, and navigating that patchwork can be incredibly difficult for consumers and for anyone trying to help them enroll.
I can only imagine the frustration and anxiety this is causing for DACA recipients. They're just trying to get health care.
It's a tough situation, and it really highlights the need for clear, consistent information and guidance for those affected by the ruling. The CCO teams are on the front lines of this, and they need to be equipped to support these consumers effectively.
And it's not just about knowing the rules, is it?
Yeah.
It's also about providing empathetic and compassionate support to those who are dealing with all this uncertainty and stress.
Absolutely. We have to remember that behind all the policies and procedures, there are real people whose lives are being impacted.
Okay, we've covered a lot of ground here. From misleading marketing to complex legal rulings, I'm starting to get a sense of just how much things are changing in Medicare and the marketplace. and how important it is for Maximus to adapt and evolve along with it.
You're absolutely right. It's a dynamic environment, and staying ahead of the curve is essential.
Well, let's take a quick break, and then we'll come back and talk about what all this means for Maximus's future. We'll explore those potential challenges and opportunities and what leadership at the CCO can do to prepare for what's ahead. Okay, so we've talked about a lot of these changes and challenges facing both Medicare and the marketplace, and it really feels like we're on the brink of like a whole new era in healthcare.
It does, doesn't it? The combination of all these new regulations and evolving consumer expectations and those big policy shifts we talked about, it's creating a really dynamic landscape.
It is.
Yeah.
So let's talk about what this all means for Maximus, specifically for the CCO. What are like the biggest opportunities or challenges that you see coming up?
Well, one thing that really jumps out at me is just the increasing complexity of everything. Both Medicare and the marketplace, with all these new rules and programs, beneficiaries and consumers, they just need more support than ever before to navigate all of this.
Yeah, I can see that. It's not just about picking a plan anymore.
No, it's not.
It's about understanding all those details of coverage, comparing benefits,
Right.
even dealing with things like those supplemental benefits we talked about.
Exactly. And that's where the CCO becomes even more vital. It's that crucial link between the complexities of the healthcare system and the people who need to access it.
So you're saying that in a way, these challenges, they also represent a really big opportunity for Maximus.
Absolutely. By offering, clear, accurate, and empathetic support, the CCO can play such a key role in helping people make those informed decisions and access the care they need. This is a chance for Maximus to really step up and demonstrate its expertise and commitment to serving the healthcare community.
I'm also thinking about the impact of those proposed CMS rules on how the CCO operates. We talked about potential changes to agent training scripts, even the types of questions beneficiaries are asking. It seems like adaptability is going to be essential.
It is. The CCO needs to be flexible enough to adjust to all these new regulations, new technologies, changing consumer needs.
And it's not just about reacting to change, is it? It's about anticipating what's coming and being prepared for it.
You're exactly right. Maximus has to be proactive, identifying those potential challenges and opportunities and coming up with strategies to address them. That might involve investing in new technologies, enhancing those training programs, or even rethinking the structure and workflow of the CCO.
It sounds like there's a lot for CCO leadership to think about. What advice would you give to those who are leading the charge at Maximus?
I'd say focus on building a culture of continuous learning and innovation within the CCO. Encourage your teams to stay informed about the latest developments in healthcare policy, technology, consumer trends, everything. Foster an environment where people feel comfortable asking questions, sharing ideas, experimenting with new approaches.
It's about empowering the CCO team to be those problem solvers and those thought leaders.
Exactly. And don't underestimate the power of communication. Keep those lines open between leadership agents, support staff. Share information, openly solicit feedback, and create a shared sense of purpose. We're all in this together.
So to sum it all up, Maximus's success in this crazy evolving healthcare world really depends on adaptability, innovation, and strong communication within the CCO.
That's a great way to put it. Embrace change, stay ahead of the curve, and empower your team to navigate all the complexities out there.
This deep dive has been so insightful. I feel like I have a much better grasp on the challenges and opportunities facing Maximus, especially at the CCO.
Glad to hear it. It's a lot to take in, but I think we hit on some of those key issues and, highlighted the areas that CCO leadership really needs to focus on.
And the conversation doesn't end here. We encourage you to keep exploring these issues, asking questions, sharing your insights with your colleagues. The healthcare landscape is constantly shifting, and the more informed and engaged we all are, the better equipped we'll be to handle all these changes.
Well said.
Thanks for joining us for this deep dive into the world of Medicare and the marketplace. Until next time, stay curious and keep learning.